Welcome to the Heartland Telehealth Resource Center, Oklahoma State University Center for Health Sciences, and Missouri Telehealth Network Telemedicine Echo. My name is Haley Bell. I'm the project coordinator for the Telemedicine Echo series, and I have the privilege of moderating today's session. I would like to go through and introduce our hub team members. So I will just go through and call each one, and if you want to introduce yourselves, I'll start off with Dr. Evelyn Nelson.
Good afternoon. Great to see everybody online. I'm Evelyn Nelson. I'm the PI for the Heartland Project and a child psychologist at KU Med Center.
Thank you. I'll go ahead and pass it over to Dr. Dina Wheeler.
Hi, everyone. Dina Wheeler. I'm the executive director of the OSU Center for Rural Health at the OSU campus in Tulsa, and we're the Oklahoma subcontract on the HTRC project.
Thank you. And I'll go ahead and hand it over to you, Rachel.
Hi, everybody. Rachel Mutro. I'm the director of the Missouri Telehealth Network and the Show Me Echo program, and I'm happy to be here. Thanks.
And Heather, if you'd like to go next for us.
Sure. Hi, everyone. My name is Heather Hagan. I'm a telehealth analyst at OSU.
All right. And then Dan, if you want to wrap us up.
Yes, I'm Dan Lund. I'm part of the staff here at Missouri Telehealth Network.
All right. And I will refrain from having our participants introduce ourselves today, just to leave time for discussion following the lecture. I do have a few announcements to run through. For a more collegial environment, we are going to be using first names during the session, so it's helpful if you make sure that your name is updated within your Zoom profile. The sessions are being recorded, and all materials will be shared following each echo. Please be conscious of confidential and protected health information during the session, and please keep your microphone on mute until ready to speak. You can also use the chat box for any questions or the raise hand function on Zoom to share comments or questions. The goal of our ECHO series is to facilitate collaborative learning and knowledge exchange among healthcare professionals to optimize telehealth delivery and improve patient outcomes. Our focus is to bring practical learning and case examples along with building networks to share information. As part of our series, I would like to introduce our didactic presenter, Dr. Molly Brown. Dr. Brown will also be presenting our case examples. Molly Brown is a community psychologist, public health practitioner, and the director of the Heartland Telehealth Resource Center. She collaborates with TRC partners to provide education, training, and technical assistance to expand and enhance telehealth services across the region. She leads evaluation efforts on various projects related to telehealth and is currently working with the HTRC team to adapt a readiness assessment. She's currently teaching an introductory telehealth graduate course at KU Center of Health Informatics and advises on qualitative methods in telehealth research for both student and faculty projects. So I will go ahead and hand it over to Dr. Brown.
Thank you, Haley. Let me share my screen. Okay, couple of technology tests. Can you see it? And can you hear me okay? Thank you very much, Rachel, for the thumbs up. Okay, thank you, Haley, for that nice introduction and for facilitating our session today. Today's focus is going to be evaluating telehealth services, and I'll be going through a couple of different things related to this, and also at the end give some resources and then have some space for discussion or questions. So really quickly, I do not have any financial or non-financial disclosures to share, and I do not have conflict of interests with this presentation. As Haley mentioned, we are partnered with the Center for Health Sciences, OSU Center for Health Sciences, and the Missouri Telehealth Network. And then our program is housed at the University of Kansas Medical Center. We are an Office for the Advancement of Telehealth grant-funded program, and it's providing the support for our ECHO series and the ECHO today. So our learning objectives for the lecture for this session is to understand the key principles of evaluation, identify key factors influencing new services or building on existing services, tools to use for evaluation, and then understanding recommended measures from experts in the field. So I want to cover the telehealth priority areas because they are driving factors for how we may develop measures or evaluate the services that we have in play. So all components of any sort of telehealth or telemedicine clinical services are going to lend to some level within these priority areas. And as we go through some of the tools and the measures that were identified, they'll make some sense related to these areas. And I'll reference some of these areas as we go through. So overall, an evaluation framework answers the questions who, what, when, how, and why. And evaluation is considered a point in time review of progress on outcomes, whether they are short-term, mid-term, or long-term. Quality improvement, which actually informs on areas of improvement within systems, fit into evaluation frameworks, as well as quality assurance, which is more at the individual level. So today we're talking about the overarching evaluation of services and programs, and not going to go too deep into quality assurance or quality improvement. However, you will see those terms a little bit throughout because they are pieces of the process. So this is just a figure related to evaluation in telehealth. So essentially, it's very similar to the generalized evaluation frameworks to assess and define. So understanding where the service needs are, what are the data that you have, taking a look at these data, and then defining what your service or program may look like, developing the program and the plan, embedding evaluation within this plan, implementing the service or the plan, and then monitoring it along the way. So this is a cycle. This isn't something that just ends once you complete an evaluation. Recommendations are going to be dependent on your goals. Is it a 6-month evaluation annually? Do you do it every 3 to 5? It depends on what your goals or priorities might be on how you develop the timeline to evaluate your services. So I want to talk a little bit about evidence-based measures and where they came from. So the National Quality Forum is a not-for-profit organization that uses a consensus model of experts across healthcare areas to inform on what these measures might be. The most recent report related to telehealth was published in 2021, and it includes input from over 40 experts that came together to develop these 5 domain areas. I'm going to go more specifically into these 5 domains. And this is actually a report that you can find it online. It's readily available. We also have it if you would like it as a resource to help build some of your measures. So these are the measure domains that were determined by the group of experts: access to care and technology, operations as it relates to cost, logistics, and models, and then experience of the patient and the clinician, effectiveness, and then equity. So I split up access to care and technology because those are 2 really huge areas, but they overlap and they go hand in hand. But I wanted to ensure that we took a look at measures specific to access and then move through all the domain areas. So initially, we look at access to care from just a wide array of areas. So is it access to what types of services, whether it's primary care or specialty care, what services exist, and then is there actual, what does travel look like for patients? And this is just a kind of condensed version. Again, the report's pretty robust, but I wanted to just give some examples. So data sources that you can look at as you address the access to care, is looking at encounters submitted and reimbursed for in-person versus telemedicine appointments. I call this one out because the Center for Medicare and Medicaid, you can look up all sorts of data within their warehouse. And in that, there are appointments specific to what they reimbursed for in-person visits and what could have also been reimbursed as a telemedicine appointment. So that information can be very valuable if you're looking at services that you currently provide, your patient type that you're seeing, what type of reimbursements are coming in, and then how you can improve or increase access by adding a telemedicine component. So that's a pretty detailed example of a data source, but this is how it would lend to access to care. Do you know what services are available in the rural areas and which are not? How many patients do you have are using new services? What do missed and canceled appointments look like? But looking at the reasons for them is because they didn't have transportation, they were going to miss work. Any reason that the patient would give you that they either no-showed an appointment or the appointment was canceled. And then it can also be helpful related to readmissions to hospitals. If they didn't have access to any sort of follow-up services or anything that could be available via telehealth or telemedicine, did it result in a readmission to the hospital? With technology, we look at broadband, digital literacy, and then system-wide coordination, so interoperability with technology. And so the data sources for this would be broadband maps. You can look at there's all sorts of resources available that'll indicate where these broadband or internet deserts might be. Are your patient base, is your catchment area predominantly in that area? That can matter in terms of the types of telehealth services you offer, whether it's real-time synchronous appointments or others. And then we include patient feedback in this area too, because sometimes you may not have an understanding of what type of equipment your patient has. And so having an understanding of that can be very important within this domain. And then of course, what sort of EHR or EMR compatibility do you have? Are there add-on components for virtual appointments? Do you need to adopt a new platform? Those types of things. So I took the cost, business models and logistics, and I put it together in the form of operations. So what is your system readiness? And by system, this could be not just your technical system, your EHR, your platforms, those types of things, but also your clinical system, from those that schedule appointments to your clinical managers, your clinicians, those providing the service. Do you have technology? So what is your overall system readiness to adopt or expand? And then what are wider financial impacts, not only on yourself, on the clinic, but also the community, and then legal and compliance. So going back to some of the data sources, looking at licensure needs. If you have, if your clinic or hospital system is on a state line, we see this in Kansas and Missouri, but then also Kansas and Oklahoma, which is where I'm sitting. And are you seeing patients that are crossing state lines? Are there licensure implications for those in your clinic? And what would you need to do to get that remedied? What are your reimbursements and allowables for the state? Coding comes into play. It's going to be tied to your documentation. So in terms of, your workflows or your, clinician, how they're operating within the EHR, what documentation is specifically needed to ensure that you have a seamless billing process and you're getting those reimbursements handled pretty quickly. And then, as I said before, you may have some quality improvement cycles embedded within this component of the evaluation, because it's continuous, you're monitoring it monthly, and this will be a systematic change that you may have to implement in order to improve the quality or safety related to these services. Now we go into the third domain area, which is experience. So patient and caregiver experiences, patient choice, satisfaction, trust can come into play related to the health system and use of technology, and then the clinician experience. And these data sources can come in, include, do you know that, how far do your patients have to travel to come to the clinic for in-person visits? Will a telemedicine or telehealth appointment fill that gap? What's the cost per visit? We may not know what insurance may cover if it's a private payer. Do you need to do a fee-for-service type of reimbursement from the patient? And will it be less expensive in terms of an expense to the patient or the clinic if it's a telemedicine appointment. What's your return on investment? So initially, do you need to invest in technologies that have platforms for these visits? Long term, how will it then benefit your clinic to have these services? So effectiveness, looking at gaps in care, time to care. So earlier and in previous presentation, I was talking about going from a initial consultation with your primary doctor, and then maybe they need you to see a specialist. So is there a gap in the time between consult and consultation? And then what are specific needs to the rural patients or those that are in your communities? So that's that example I gave for the data source. Are you reviewing the time between a provider request for consult and consultation, for example? What about the time it takes for a patient to get in to see you again for a follow-up? Are you missing opportunities to have more appointments available for patients if you add a telemedicine or telehealth service to your clinical services? Then how integrated are these appointments in your care setting? So then we look at equity. We know that access to care and quality of care it does differ across different factors and those within our communities that are seeking care. Social determinants of health are those non-medical factors that influence quality of life, and those do impact access to care tremendously. And then how does telemedicine or telehealth address these inequities? So taking a look at the network and care gaps, knowing that maybe having these different offerings would actually decrease the gap. So again, going back to from consult to consultation, maybe there's transportation issues, maybe there's work issues. You can't take off work for an appointment. Those social determinants of health that influence. And one piece to consider too is how are you monitoring currently, or will you have a measure in place to understand, are these appointments, are these telemedicine, telehealth appointments improving and reducing the inequities, or are they actually worsening the disparities because of thinking of broadband deserts or digital literacy? And you want to make sure that you're considering both sides of it, understand how helpful it can be in improving access, but at the same time considering if you remove a service that would normally be in person and only have it offered via telehealth, then is that going to worsen access to care? So here's some of the resources that I've pulled together. As part of the Heartland Telehealth Resource Center, and as Haley indicated in the introduction, we have a readiness assessment. We call it a readiness assessment because it's not just readiness to adopt a new service, but it's also readiness to expand on existing services. We've made some updates and edits since the end of the pandemic because there are things that we know that have shifted in clinical practice, and it's very strongly related to regulation, technology, even organizational adopting and cultural adoption. The idea that these services complement but also are just as effective in quality in care. And so we've made these adjustments with this assessment, and it is part of an evaluation process that we offer to those that need a little help in this area. This is just a quick snapshot of what a report would look like. It results in a heat map within these designated priority areas of measurement. So it can tell us that at a level 5, if we look at billing and funding, you have your financial cycles and your billing cycle processes pretty up to speed, and you've got a pretty good process in place. But maybe looking at community engagement and consumer experience, at feedback and experience, maybe your team identified that you're not consistently getting information from your patients or feedback from your clinical staff. And so what would need to happen, and what are tools that we can help you build to ensure that you're consistently getting that feedback, you're applying the recommendations, and you're gauging, you're gauging how things are going. So another resource that I want to kind of shine a light on is the American Medical Association Telehealth Implementation Playbook. I'm not going to go into all the details of it because it is a really good tool that you can use that gives you some really good, processes, checklists, tips and tricks on how to get started and plan and then implement. But I will talk a little bit about the evaluation section because that is part of the whole process. Being an evaluator, I've always been told, begin with the end in mind. You don't want to have to chase data after the fact, realize you missed out on an opportunity to collect valuable information if you consider evaluation at the beginning. You can always plan for it. It's not that you missed if you started a new telehealth service like many did during the pandemic as sort of as a band-aid, and also ensure the continuity of care. And now here we are post-pandemic, the public health emergency has ended. You still have some of those services in place. You can always start the evaluation process at any given time. You can identify measures that you might be missing out on, and then you can start implementing, collecting those measures. But took a little tangent there from the playbook, but there's a lot of really good information in this playbook, and we will be sending out these materials afterwards so you can get this link and download it and review it for yourself. Within the evaluation section, again, we have this figure about assessing, defining, develop, and then implement and monitor. But it's really identifying what your needs are, taking a look at your baseline that you have now, where are areas that you can add to, what measures do you need to include that you're not including now, and then working through the process to include your team in the evaluation process, partnering with your patient to gain information, and then continuing the evaluation cycles. Evaluation can be really powerful too when you want to make the case for leadership to support maybe shifting funds, changing financial models to scale up or add new services. So this is still part of the AMA playbook. And the reason why, like I said, I brought it up because they also have in their appendices, they actually have surveys, both for the patient and caregiver, but then also the clinician and staff. You may already be doing this. Many of us get those after appointment surveys, but have you considered, does it include the technology or equipment questions for your patients? Does it include any sort of, if we were to offer X service via telehealth, would you be more apt to use it? Would you choose this over this? You may not have those questions in there, so you can pull from some of these surveys that have already developed them for you, and you can just add to that. It's also important to remember getting feedback from your clinicians and your staff, because they will be the folks executing the service, following it through the process, and providing feedback at the end of each appointment, and letting you know how things are going from their perspective. And then, of course, the equity, this is also from the playbook, thinking about it in terms of taking that equitable approach across all of these different areas and the domains in the virtual care system: clinical outcomes and quality, access to care, patient experience, clinician experience, and then the operational impacts, which your clinicians and staff will also inform on. And you'll notice there is that the social determinants of health aspect that's considered across all of these areas. I bring up our technology. Telehealth Technology Assessment Center is a nationally recognized telehealth resource center. They're also part of our consortium. They have a toolkit specific to assessing your technology. So as you can see, I pulled out a couple of key areas that they measure within their toolkit. But you'll look, there's hardware integration, software integration, but also workflow integration, which lends to then evaluating your operations and how are things going from start to finish. How is it embedded in your workflow? Do you have things in place in the event that technology doesn't work? How often does that happen during just our Zoom meetings? You want to have, what is that in place? So this toolkit is answering, what do you have? How do you use it? What do you need? It also includes the end user experiences. End users being the clinicians and staff, your clinicians and staff members, but also patients. And so all of these things are intertwined together, and you see that in these various tools. One thing that this resource center also does a good job at is keeping up with needs and technology advancements. Just looking at the news today, you see so much just rapid fire technology happening. How can your clinic and your services stay up to speed with that? And it would probably involve an evaluation at any point in time to determine how things are working with your technology. What do you need to fix? What do you need to discontinue use, and those types of things. So I will hop into some of the case examples that we have. If there aren't any questions or comments on the previous information I shared. Okay. I pulled this example from that AMA playbook I talked about. This is a large hospital system in Los Angeles. But one of the things that, what they did was they determined, what are our goals? They looked at their current state. So where are we at right now? What would we like to see? So I'm looking at their goals, and I assume that maybe they have high wait times because of getting into in-person appointments. So they want to reduce those. They want to provide, they want to reduce absenteeism from school and work. Thinking in terms of being a children's hospital, these are parents or caregivers that are having to take time off, pull their children from school, maybe spend a good 2 hours or an entire afternoon for an appointment that could be taken care of via a telemedicine appointment. They want to reduce those no-show rates, and they want to improve clinician satisfaction. So these are the metrics that they used. So this is a real case. These are the metrics that they used to look at their current state and create a baseline, and then implement services that would help them reach these goals, and then reevaluating again to see how it went, essentially. So a lot of the metrics that I've already gone over, how many telemedicine or telehealth appointments are currently in place, what's the volume, how many of those appointments are kept versus unkept. And then we have, who's already trained in this, who's already using it within our clinic, who's trained, and who needs to be trained. And then where are the appointment opportunities? We go into satisfaction. I thought this one was interesting. You have shifts in utilization of clinical space, what we would call real estate in a clinic. And how often have you gone for a in-person appointment, and some days you come in and come out and it went great, but in some cases maybe there was some situation that occurred that the patient they're still doing what they need to do for the patient, and so you're having to wait and wait for your appointment. Well, looking at the data that you have, is this an opportunity? Was your appointment a follow-up that could have been handled via a telemedicine appointment? And it's something that you would have used. So looking at that and how you can then reallocate some of these clinical spaces for in-person appointments that cannot be telehealth. The second one is a case that I pulled from a journal. Now, this case is dated 2021, so you're going to see some stuff that's really more focused during their pandemic time, but their process is the same I mean, it's essentially the same process. So what they wanted to do, this was an FQHC in Minnesota, and they wanted to identify areas to build or improve, increase access, and then decrease burden on clinical staff. Again, this is during the pandemic, but it still resonates today. So what they did was they did a SWOT analysis initially. So strengths, weaknesses, opportunities, and threats. And then they did a gap analysis looking at current staffing plans. What would it look like if we implemented more telehealth services? Is staffing in place to do this? Is training needed? And then what would the implementation plan be? And then they then scheduled a timeline for ongoing monitoring of their use. So this is the results of their SWOT analysis that helped inform on whether it was a good idea to increase services, make them permanent, because one of the concerns, as you can see, is the end of the public health emergency and waivers that were going to allow these services to continue. So they were already planning ahead because they knew they wanted to keep the service, but they needed to identify what was going well, what needs to be improved, opportunities available within their clinic or outside the clinic, and then why they wanted to consider these things. One of the threats also being internet connectivity and speed in rural areas. So you look at this as a kind of a balance. Is it going to be worth us to take on the threats, improve the weaknesses to ensure that we have a nice, high quality service? And then this is their gap analysis. Again, taking into mind that this is during the pandemic. But one of the one I want to kind of focus on too is their goal would be to assign more clinicians to the telehealth on a regular basis. Current, they're not doing that. The identification would be to offer these services when possible. We'll go back to the data that you can pull to see where this would fit into your integrated into your clinical services or your work plan, your workflow, and how can we make this work? And then they set a goal to create a schedule. And then the assumption is that they created the schedule, then they're going to test it and they're going to see how it's working. This is where your quality improvement would come into play. And then they would evaluate in about 6 months to a year to see how do we do with this and what do we need to change. And then they did a utilization review. So they have their total appointments versus their telehealth visits, and then the percent that were telehealth. Again, this is I keep repeating myself. I just want to make sure we're noting that this is during the pandemic. But if we think of the timeline of the onset of the pandemic, and then as things started changing over time, if you take a look at August of 2020 to September 2020, you can see their telehealth visits declined. Well, then the assumption would be maybe they implemented some of those goals that they had. And then we see that increase up until November, which is when they're reporting on that they have an increase now of their telehealth visits. Did they implement patient satisfaction or surveys? Did they upgrade their technology? Do they have a new patient portal so it's easier access to patients? I'd have to go back to the case study itself to see exactly what they did. But this is just an overview of how they evaluated their services. So then we have from that clinic, they did also provide lessons learned. So this is really important. You go back to your team and you say, okay, we planned it, we implemented it, we're monitoring it, but now let's go back and see how did this whole process, what did we learn from this? And they needed to create buy-in, whether it was with staff, clinicians, or leadership. The communication shifted because how you may communicate not only with your patients, but clinicians during telemedicine appointments. What if you have a provider that's offsite? How are you communicating? What are financial implications? We know that those have shifted since May of last year. And how is that impacting billing? The evaluation process, embedding it into their practice, and then addressing challenges as they came. What were the challenges? How did we overcome them? And what are we anticipating in the future? And then this is the last case example, also pulled from the AMA playbook. This is looking at hypertension and monitoring blood pressure across all of these, how it impacted, how implementing a virtual care digital medicine program for monitoring blood pressure and hypertension across all these areas impacted it, and how it actually, what their results were. So this is an actual health center, then this is what they did for hypertension. And going back to my days back in clinical, when I did patient care, anytime we monitored blood pressure, back then, I'll say, was the patient came into the clinic, and you either did it depending on what you needed to monitor. They came for blood pressure checks. You had specific, they came in for their blood pressure, whether weekly, daily, and that can become, when you're thinking about equity and access, that can be a really tough thing to do consistently. And so by implementing, maybe it's smartwatches, or they have a cuff at home, they report it in their patient portal. However they established the virtual care mechanisms, then they were able to do it more frequently and more consistently. There was higher patient satisfaction because they didn't have to take time off work or drive into the clinic or get to the clinic in some way to get their blood pressure check. Clinicians are able to provide more patient support, identify things more quickly, because you're able to get more consistent data from the patient, and you're able to really, are there medication adjustments that happen? Now you're able to do it without either missed appointments, missed blood pressure checks, any of those things that would interrupt care. And then also they reported a savings plus a almost 30% reduction in clinic visits. Because if you think about that, you're tying up staff time as well, a wait time in the lobby for them to get to the blood pressure. And now you're able to do it, within their own home. If you take into aspects the social determinants of health, you're looking at, again, they have to consider the technology access. Are they having do they have the equipment that they need at home or outside of the clinic? But then also you're reducing, if there's transportation issues, and you're also putting some some savings, and then also prevention into play. So now that is all I have in terms of the presentation, and I can we can have discussion or take on any questions you may have.
Molly, it looks like a question had come into the chat from Michaela. They asked, when a provider is off-site on their note, do they need to state where they are at specifically, or can they state office even if they are not in office?
Oh, Michaela, you're asking me a billing question. I would actually defer to maybe some members of my hub that can help a little bit with that. I know that there are documentation related to billing for distance site and those types of things related to being able for a provider to bill in that way. If you're asking in that sense, there's specifics to that. But if you're asking in terms of being able to provide a service, it will be tied to billing. So I can get you that direct answer. I would say depends on how they are. Depends on how they're contracted. If they are an external consultant and they have their own practice within their home or off clinic site, then there's going to be requirements specifically to Medicare, Medicaid, maybe not as much with private payer, also depends on state, but I can get back to you on that. We'll take note. We have a lot of depends on. Are there any discussion? Are any of you currently involved in evaluating your clinic services? Have you implemented? I'd be curious to hear like what you may do within your clinics or your practices. If you have what your standard timelines are, things that have been working for you, if anybody would like to share. Do any of my hub partners have any jewels to share?
I think it's like, oh, sorry.
No, go ahead.
I was just going to interject from I'm at the medical center, so I know it doesn't apply to every situation. I appreciate what you said, and Molly, and we can reach out to our billing and coding expert. I was just going to share it at our institution. We do document the actual place and state that our provider is at. There's kind of standardized language that our institution provides that then aligns with the billings. So again, others may have kind of different boilerplate language, but just sharing that's how our institution has approached it.
Thank you. Rachel or Dan, with some of the work you're doing in Missouri and helping establish services with different clinics, have you seen anything come in specific to requests for types of metrics or measures? Any tools that you've shared for them related to evaluating or implementing QI?
The project, Molly, by the way, really great talk. Thank you. The project that Molly's talking about is called, it's a project called Rural Citizens Access to Telehealth. And the state of Missouri decided to use some of the federal ARPA funds to increase the use of telehealth by providers who care for patients that are covered by Medicaid in rural areas, specifically primary care and behavioral health. And we are assisting the state in getting some of these projects up and running. And in regards to the evaluation of those projects, the number one metric that we want to see is that an increase in the use of telemedicine for patients that are covered by Missouri's Medicaid program, which is called MoHealthNet. So we are partnered with one of the organizations that that manages all of the Medicaid administrative claims data. And we will be looking by organization and by provider to hopefully see an increase in the number of visits that are offered through telehealth. So making sure that people appropriately code things is super important. And I know things have changed over the past 5 years in regards to telehealth billing. We use the place of service now versus the old modifier that had previously been used. And so we're really hoping that we will be able to see it in a couple different ways. So we're asking the organizations that are funded to send us reports. So we want to know the reports that they have, how many patients were able to use the technology, what kind of visit was it, who was the healthcare provider, et cetera. So those will be pulled from the patient's electronic health record. And then we will be independently looking through the Medicaid claims data to see if they approximately add up. So we're excited because so one thing to note is not every patient that utilizes it through this program will be covered by Medicaid. There will be some uninsured, there will be some Medicare and some commercial payers, et cetera. So it will be good for us to take a look at both areas so we can see the differences.
Thank you, Rachel. I think it's a really neat program that they're working on, and being able to help decipher, go through a lot of data. We know how EMR data is extensive, but then being able to pull everything related to the health record, and then from, you know, the actual clinical appointment all the way to any other services they get through the clinic. There's a lot of information to pour through, but there's so much that can tell you how either changing appointments or adding appointments for telemedicine visits can be beneficial. And I think that's the piece that sometimes we miss as we launch these new programs. And again, I'm biased because I come from an evaluation background, but how it lends to the story that, you know, your story as a clinic, but then also what you may need to do for the community and the organization, balancing all of those different aspects of it. Was there anyone else that wanted to had any questions or wanted to comment? Well, thank you very much. I've just got one more thing. We have some upcoming dates. We're still working on our April and May dates for our ECHO topics. Again, we want to have some focus areas related to how you can build or enhance and continue the great work that you're doing. We will have June 11th, we have Rochelle Marting. Some of you may have experienced some of her great webinars on billing and reimbursements. We will be talking specific to how you can maybe streamline or fine-tune your billing processes within your clinics or systems. And then on August 13th, we have Dr. Evelyn Nelson, who's going to be talking about practical tools to avoid digital burnout. So essentially, you know, how we care for our clinicians and our staff that are providing the services, tools that you can use to help, you know, avoid the Zoom fatigue, if you will. And then finally, you can always contact us at our email address, htrc@kumc.edu, and then you can visit our website. This will be recorded and sent out to all of you that attended. So greatly appreciate you sharing your time with us today. Again, let us know if you have any questions and email us, and we hope to see you. We will be in touch about April, our April date. If you're already registered, you will receive the updates. So thank you very much and have a great rest of your week.